Hello and welcome to the Society with Fatma Shaheen at PTB World. It is a community that we live in, and it is a community of which we are all a very important part of, which then of course raises the question that what all does community health entail? Now when we talk about community health, we all understand the fact that it is that intersection of healthcare, of economics, as well as of social interaction at the end of the day. Primarily, what all does community healthcare entail in any society? This is what we'll be talking about in our today's show. We'll also be, delving upon the fact that when we talk about the current government's initiatives, what all has the current government done when it comes to provision of healthcare facilities? And last but not the least, we'll also be shedding light upon the fact that what role does the Pakistani media have, especially when it comes to patient education? This and much more to follow on today's show. And to do that, let me introduce you to my today's panel. My first panelist for the show today is Ms. Mariam Zahid Malik, who is a public health expert. Assalamu alaikum ji and welcome to the show.
Assalamu alaikum Fatma, thank you for having me.
You're most welcome. And my second panelist for the show today is Dr. Naeem Majid, who is a technical focal person for immunization in Punjab. Assalamu alaikum Dr. Saab and welcome to the show.
Welcome Saab and thank you.
You're most welcome. And my third panelist for the show today is Dr. Amara Khan, who is a public health nutritionist. Assalamu alaikum Dr. Saab and welcome to the show.
Walaikum assalam, thank you.
I would like to start the show with you, Ms. Mariam, that when we talk about community health per se in the West, especially in the UK, we see that this concept is very well defined. But what about Pakistan? What all does it cover? And how aware at a very basic level is the average Pakistani about community health?
I think in Pakistan, community health is still not very recognized in the sense it's not structured in that way like in developed countries.
Right.
But if you see what community health is actually, community health basically caters to promotion and protection of the health community at large. And it not only caters to the service delivery component of the health part, it is basically related to awareness, it's related to sensitization.
Right. And if I may add, the WHO definition of community health is all encompassing. That very particularly says that it is the environmental, social and economic resources to sustain emotional and physical well-being amongst people. So I think this is practically a very big branch of public health, so to speak.
Exactly. It starts from not only the disease prevention, but all the underlying factors, underlying determinants that actually bring that
disease prevention, disease identification, and I think a very important component of it is education, on which, sir, I'll come to you, because I understand that you've been working very actively on this both nationally and internationally with the government per se too. So when we talk about people being aware about community health, when we talk about them knowing that yes, there is this provision of community health workers who they can possibly go to, especially lady health workers in this regard, how cognizant do you find the average person to be?
So we can broadly define the population into three groups. One is the urban group, then other is the rural one where the lady health worker is present, and the third is the rural one where lady health worker is not present. So in the urban areas, the people are comparatively more literate and they have more access to information, they have more access to health facilities, hospitals, everything. So they are a bit more aware compared to the general population without any intervention from government or anyone else for that matter. But when we talk about the rural areas, so they don't have so much access to media or like social media as well as the routine television channels and other things. So there the government has provided lady health workers. So the lady health workers, she goes from door to door and she provides information on preventive health services, primary health care, maternal and child health, nutrition and other
But sir, does this cover all facets of community health? Because from what I understand, community health itself is also a very wide, all-encompassing subject. It might, cater to reproductive health of women, for that matter, child issues, child nutrition, on which I'll ask more from Dr. Saiba. But what about mental health issues? What about other issues like breast cancer in women? Does it cater to those issues, especially the socially taboo issues?
So this is a very interesting question. So when the program started in '94, at that time these were not part of the program. The program's name was National Program for Family Planning and Primary Health Care. So it focused on family planning half of the time, and half of the time it was for primary health care.
Right, sir.
And but now when we look at the definition of primary health care, it includes all these things which you mentioned, like mental health, like nutrition, like breastfeeding, like non-communicable diseases like even diabetes, like cancers, everything is part of it.
So basically chronic illnesses and even those illnesses, you know, which might not relate to one's, you know, physical body ailments, so to speak.
I just wanted to add
Please
on to
do.
that when we are talking about all these aspects like mental health, I think the community-based workers like lady health workers are not very equipped to actually cater to those requirements. When we talk about mental health, they are not trained for that. Similarly, when we talk about other issues like this, because they have a very limited training to that is the actually the place where the capacity needs to be strengthened.
Right, but per se, sir is saying that they are covered within community, and that was my question, like substantively speaking.
Yeah, and further adding to the one she mentioned, so as I earlier also pointed out that it was not part of the actual program, but now gradually things are being added on. So like we have added communicable diseases like dengue has been added in the work of lady health worker. COVID when came, so it was also added to the work of lady health worker. Similarly, mental health and cancer screening is also now gradually being made part of their curriculum. They are being trained on it repeatedly because it was not actual part of their initial curriculum.
Right, and let's hope that, you know, this way it will get more momentum, because at the end of the day, these lady health workers, they have a very important part to play, especially when we are talking about, you know, slum areas, rural and slum areas of Pakistan. But coming to you, madam, I think a very important question which does arise in this regard, and since you are the public health nutritionist here on the panel today, that, you know, Pakistan has been faced with the issue of malnutrition per se, but how acute or how, you know, pertinent has this problem become, especially since the COVID-19 pandemic struck in?
Basically, if we look at the country's nutrition profile, that has been very complex. For example, if we were talking a decade back, we were only talking about undernutrition, but over the years, burden of overnutrition has increased in the country as well. Going further, if we look back into the data, we find out that majority of overnourished children are micronutrient deficient at the same time as well. So at the moment, country is facing triple burden of malnutrition. And given the COVID situation, things has actually gone worse, because given this COVID situation, lifestyle changes as well as dietary modifications has actually worsened the indicators. If we talk about undernutrition, then post-COVID economy impact has impacted the nutrient intake of the population.
And I think in this regard, Dr. Mara, we must also, you know, not miss the fact that it's just not about undernutrition. A lot of times, like in America, we see that obesity is a big problem. At the end of the day, they are getting the nutrition, but they are not getting the right nutrition. So I think that per se, does that fall within malnutrition too?
Yes, that has actually been impacted by the sedentary lifestyle as well. This COVID has impacted majorly lifestyle of young children as well as majority of the population.
Right. So we need to consider malnutrition just not from one facet, from different facet as it does arise. On that, I'll come to you. Ms. Maryam, I was reading this report of the UN Women Volunteers in which it was very interestingly highlighted that, you know, during this COVID-19 pandemic, there were women health workers in Afghanistan who came forward and, you know, who took the responsibility on themselves, wanting to educate people, especially women, about, you know, COVID-19 per se. Now, education, we all understand, is very important. It is very important to educate people about community health. But do you not feel that equally important is also ensuring that they have that right access to the healthcare system?
I think other than the access, when you're saying that access to healthcare, for that you need a strengthened primary healthcare system, which should be at the grassroots level. The community health workers are a linchpin and the agents for change in that system. And the concept of having strengthened basic health units and rural health centers, that is why play a very important part, so that the people having the first point of contact for any person, for any ill person with minor illness, should be the first the level care facilities. They are the ones that should be taking care of.
I think this is another reason why we need to invest in our community-based workers, because there are so many countries like Sri Lanka, like Thailand, where these systems, where the community-based workers, they are so much encouraged, and they are so much liked that way, that they actually intermingle with people in the villages to take care of their health problems.
When you
and a lot of times we don't even need to go to hospitals that way, Dr. Naeem, because you've yourself been working on so many initiatives where you've been leading all these vaccination campaigns with the government and otherwise. I think more particularly in Punjab, I believe. So tell us more about them, that how has the vaccination rollout been both in terms of COVID-19 as well as children vaccination?
As you mentioned, the immunization program of the government of Pakistan is one of the best examples in the world, because every vaccine is being provided by the government, the essential vaccines basically, not all but the essential ones. So, for the children we have 10 vaccines which are provided from birth till the child is 15 years of age across the country, and in Punjab we have one extra dose at 18 months.
Right.
So, these are the vaccines which are given to all children irrespective of where they are located, whether they are in urban areas, whether they are in rural areas. And we have vaccinators who go from door to door, and they have mapping of all the children. They have registers of every child by name and parents' name, age of the child, and the due dates of the children.
Right, sir.
So, they go to their respective households, they knock the doors and bring the children out and vaccinate them. And the vaccine quality is so good that 99% of our population across the country gets vaccines from this government service. Only 1% is for the share of private sector in this.
This, sir, you're particularly pinpointing towards children's vaccination, which includes, different kinds of vaccinations that they need to get done, including polio, of course, as we all understand. But what about the COVID-19 rollout? Because we understand that, when COVID struck in, when the vaccination did come, there was this initial vaccine hesitancy, not amongst, common members of the public, but even in doctors like yourself.
Yeah, exactly, it was like this, but the government's strategy was one which everyone appreciates internationally, as well as we all the health workers also appreciate it, because the government had it in a very planned and staggered approach, because the first priority was given to healthcare workers who were immediately dealing with the COVID patients. So, they were vaccinated first of all, then the elderly population was vaccinated, and gradually the age bracket was increased till now, and now it is given to all 12 plus across the country.
So, sir, in this regard, would you like to share some statistics, especially when it comes to, being the technical focal person for immunization in Punjab?
Yeah, so if you will look at the figure, so in Punjab we have covered 90% of the population for at least one dose, and for fully vaccinated we have covered almost 75% of the population, of the target population. So, when we call target population, it means 12 plus population. So, the children below 12 years, they are currently not being vaccinated for COVID vaccines.
Right, so your point is noted, but I think in this regard, Dr. Saiba, we must also talk about the role of media, because media has that power to make or change perspectives at the end of the day, and media has to play its responsible and constructive role in doing so. So, what emphasis, what significance would you attach to media's role in this regard, especially when it comes to educating the patients about the healthcare rights?
I think there is a very key role of media and awareness in this regard, and not only in this regard, in regards of all health related indicators. One has to know their rights, and that's very important that communities understand the importance of different healthcare programs in the community. For example, if we talk about immunization, this is one of the very good examples, as Dr. Naeem has mentioned, that they have vast outreach services in terms of EPI. But if we look at the figures, I think it's very important that people should take this responsibility themselves, and these health seeking behaviors should improve. Only then you can see that we can get the exact results.
Right, madam, your point is noted. But coming to you, Mariam, I think we must also talk about the responsibility of media. When we talk about the responsibility of media, I think the responsibility of media has to be very constructive this way. It is like a double-edged sword. Exactly. You need to educate people about healthcare provision, about their rights which relate to their health, but at the same time you just can't scare them. So, where do you feel can media draw that line? Rather, how can it do so?
The role of media, that it is acting responsibly, and if the right message is put through, you will have positive outcomes. And the role of communities here is very important. The communities need to be engaged in these public health interventions, like we saw in dengue.
Right.
I think the role of community is the most pivotal in the control of dengue, because their good practices, public health good practices, are important to cater to such things.
So, you wanted to add something to that?
Yeah, so I wanted to add the responsibility of the citizens, of the people who are using social media, because the social media is these days much more powerful than any other media, because one message gets spread so fast, and everyone reads it and it gets viral.
So basically, sir, I think the message that you want to put through to people is that the responsibility also lies on the community who is actually making use of that media at the end of the day. I think it's just you know, a collective responsibility of the entire society. Coming to you, I think we must also talk about, when we talk about malnutrition, we must also talk about stunted growth, because this government you know, since it came into power, has been very focused on basically catering to healthcare provision, and recently they've also launched the Ehsaas Nasho Numa program. So tell us more about that. How, you know, efficacious, how effective do you see it as a public health nutritionist?
Thank you, Fatma. This is very important question, because we have highest number of stunted children in the world, and at the same time, if we look at the scenario of overall nutritional status in the country, that is also not improving since ages. So stunting is the chronic form of malnutrition, and we have this opportunity till the 2 years of age, we can reverse it, otherwise it becomes irreversible. It starts from the utero, and it is very, very important to take early initiatives in order to prevent stunting, because
so it's something which basically can happen pre-pregnancy too. So in the larger picture, we are just now targeting to address it from the viewpoint of the child, but of course it also covers maternal health.
Yes, it starts from the maternal health, and I would say it starts from the adolescent. It is very important to focus on adolescent health, because today's young girls are going to be the mothers of future. So it is very important. And talking about Ehsaas Nasho Numa program, this is a very different type of program in its design, and it's expensive as well in terms of its interventions, because this program targets pre-conception and start from the conception till 2 years of the child's age.
So basically it's all encompassing. It's basically targeting the root causes of malnutrition as they do stem from stunted growth.
Yes, because malnutrition starts at the time of conception. So I would say that 1000+ model is actually the one that we should be focusing on, that includes adolescent health as well. But this program basically targets the poorest segment of the population, where pregnant and lactating women are being given conditional cash to use healthcare services to improve their antenatal, postnatal and vaccination services. Also, in addition to that, these pregnant and lactating ladies are given lipid-based nutrition supplement, which is high in energy, high in protein and micronutrients, in order to make their nutrient and micronutrient intake sufficient to meet their requirement.
Right, Dr. Amara, I think you would want to add something to this, since you are very closely working with the government, sir, that you know who all then fall within the purview of this program.
Okay, so basically this program is for the poorest of the poor, and the way they selected is they did a poverty analysis survey in the communities across the board. It was like a census, and every household was measured and a scale was prepared, and then they decided that this percentage of the people who are falling below this criteria will be provided this kafalat program. And how
they will be included in the Ehsaas Nasho Numa program,
as well as in other Ehsaas programs.
Right, sir.
So and this the bar for this was set depending on the budget which was available. So it is not like this that we will give to 20% or 30%. So it was about, if our budget matches to 15%, we will provide to 15%.
Right.
So
but it's still a very commendable step in the right direction, and I think in this regard we must of course not miss the Sehat Sahulat program, the Sehat Sahulat card that this government has been very proactively working on. So tell us more about that. What is its scope, and you know, how do you see it covering different facets of one's health? Is it just limited to indoor patient facilities, or is it also extended to outdoor patient facilities?
Sehat Sahulat program, it is for all the people, like in Punjab every household is registered with Sehat Sahulat program, and every individual is automatically by the virtue of their national identity card number. So the people, they don't need to have a separate card, although the government is issuing a separate card, but even if someone does not have it, they just walk into any hospital which is on the panel of this program. They can go and give their ID card number and they can get the services. Currently the services, as you asked, are limited to indoor services only. The outdoor and the preventive health is not part of this package. Another initiative which the government took up during these COVID days, when people were unable to go to the health facilities to get the OPD care. So the telemedicine was started, and many of our public sector universities like King Edward Medical University, Fatma Jinnah Medical University, University of Health Sciences, all of them opened up, even Rawalpindi Medical University, they opened up their own telemedicine centers, and they had their helplines where people could call simply a simple phone call, or they could do a WhatsApp call or a video call over WhatsApp or Zoom, and they could show their signs and symptoms as well as describe their history, and they would get prescription.
This again I think has been very revolutionary for the entire healthcare system, so to speak, because of course this is something which was not there before. So I think where COVID-19 has shown us maybe a dark side, it has also shown us a bright side, that how can we grow as a society, how can we make changes within our existing system, to which I would want to come to you, Ms. Mariam. We must also talk about this whole argument in the context of the socio-cultural norms that we do have, because a lot of times we do see that women, unfortunately, they don't get the right nutrition, because it is said that you can eat last, or you don't need to have that protein rich food. So this is something which does unfortunately stem from our cultural norms and the way we are as a society. So where do you see the link between changing our social cultural norms and also ensuring that women have that access to healthcare, they do enjoy that right to healthcare which anybody else does in our society?
Thank you, Fatma. This is a very critical point because women form 50% of the population. So giving them the access to healthcare is important. And when we talk about health system, 70 to 75% of the population is actually women and children who are the most vulnerable, and who needs to be, like Amara said, at the place where there is double vulnerability. First they are poor, and then they are pregnant. So that is where the health system needs to be.
And then the COVID-19 has further
marginalized them. Further, the barriers to access are needs to be catered to, where we should have initiatives like mobile health care, bringing the health care to their doorstep.
Right, Mariam, your point is noted, on which I think in this regard something which we were all earlier discussing, that the role of media in patient education, that is extremely crucial.
That's right, Fatma, and that is one of the key strength of these SRs programs, that these are women focused, and we have more and more female staff available over there, and these females are being given conditional cash on uptaking of health services. Also this is type of empowering them by giving them conditional cash and giving them right advocacy and education, telling them that this is their right. That is one of the key element of these
right, because at the end of the day, madam, I think this is a socio-economic issue, as we all understand, so everything has to go side by side. So you've also been working on this whole concept of developing community midwives and deploying them rather than having birth attendants or DIs as we call them basically. So tell us more about this project, that what has been the success of this project and what has been its scope or outreach.
Yeah, so this is a very relevant question since we are talking about nutrition as well as for maternal health. So in 2007 the government of Pakistan initiated this program by the name of National MNCH program, Maternal, Newborn and Child Health Program.
Right, sir.
So a major component of this program was development of a new cadre, which is community midwives. So the community midwives, the purpose of this cadre was that they will ultimately replace the traditional birth attendants, the DIs, who are working in the community. So the government trained a huge number of community midwives. So over 10,000 were trained across the country, and they are working in their own houses. They have a separate room in their house where they conduct the deliveries, or they also provide doorstep deliveries if someone prefers. They have a kit, they take it with them and go to the household of the woman, and there they do the delivery.
Right.
But this program was started with the concept that women don't come to the health facilities. But in Punjab, surprisingly, we had a very different program as well, which was the 24/7 basic health units. So the basic health units were converted to round the clock. It started as a pilot, and then in 2015.
And right now as well, the government is working on introducing more basic health units, like we were earlier speaking, especially in Islamabad, both primary as well as secondary healthcare units. So tell us more about that too.
Yeah, so that when the basic health units were converted to 24/7, so even in districts like DG Khan, where we were expecting that women would not be coming to the health facilities for their births, so they started coming, and there is a very famous basic health unit, Haji Ghazi, where there was zero births happening when it was functioning only during the morning shift, because deliveries usually take long time, and the patient
and they can happen at night as well. Anybody can go in labor any time. So I think this is something which must be talked about, and I'm very glad that you raised and explained it so comprehensively. Coming to you, I think we must also talk about, when we look at this whole thing, we must also talk about the importance of community based workers per se. Now we do see that that, world over they are given that importance, they are given that significance, but in Pakistan, you might beg to differ, at least from my perspective, I do feel that they are undervalued. So how can we educate the common Pakistani out there, especially when it comes to, telling them about the importance of community-based workers, especially with regards to, of course, improving community health?
Yes, I think first and foremost, we should sensitize the community regarding their role. And when we talk about LHWs, lady health workers, they are their own representative of their own community. They know each other well, they know their families. So here we need to have that, we need to equip those lady health workers or the community based workers. We've seen in polio.
Are they well paid, Ms. Mariam? That's another thing, because this is a debate which has arisen from different quarters, and I think sir would also be able to comment on this, because there are those parts of the world where they are actually paid, they are properly remunerated for this, and then there are also countries which just keep them as volunteers. So where does Pakistan fall?
I think I'll just let Dr. Naeem respond to it as well.
So you wanted to add something to that?
Yes, Pakistan falls in the better spectrum over here, because we are paying the lady health workers a handsome salary. It is not too much, but still it is not too less, and it is a regular salary. They are regularized. They will even get pensions once they retire, so they are like regular government servants. And in most of the countries, the community health service, it is usually a volunteer. So most of the countries, they just give an identity to them, and they feel privileged that they are health workers, and they just work.
No sir, some countries pay them as well.
Yeah, I am coming to that. So and there are some countries where they give them some honoraria, like a small stipend, and in some countries they are fully paid. So Pakistan is among those where they are fully paid. There are other incentives as well, like if they are given this some sort of identity that their patient will be treated on priority when they refer to the hospital, or when they themselves are in need for some health services, they would be given on priority basis. This is currently not being done. So they are treated just like any other citizen, and so they have to go through all the queues and everything. So this is something which should be given to them, which can encourage them to work more and work more motivatedly.
They have to be made to feel important, basically, which is why they can add more value, more worth, and of course be more focused on their work that way. On which I'll come to you, Dr. Saib. I think we must also talk about the changing trends of breastfeeding. Now this has become a social issue, and I'm saying that because over the years I've seen that this trend of breastfeeding unfortunately has taken a backseat. A lot of mothers these days, especially those who are working, they tend to switch to just giving their children top feeds. So as a nutritionist, how detrimental is this as a trend? Because at the end of the day, you are also harming the baby by not giving them the right nutrients.
When you talk about the nutrition, breastfeeding practices is the key important thing that needs to be considered. It's not only associated with undernutrition, but it is also associated with overnutrition, as you have very rightly mentioned, that if we look at the statistics over the year, this situation has gone worst. It's not only with the working woman or in the well-off component of the society, but these...
No, I think for the working woman, it might be more easy for them to say that, we are going to work, so this is something, lifestyle change that we can't, relate to, or we can't basically adhere to.
Yes, because there is a big disconnect of advocacy, right advocacy and right support as well. I always talk about the support. Breastfeeding is not an easy job. Mother need a full support from the society, from the household, and also from the community health workers,
from their employers too, basically.
Employers as well as from the healthcare providers as well. For example, in Pakistan, you will never see any support for mothers to express their milk, for storage. You see appropriate advocacy on storage and how to feed this expressed milk to the child, and this is quite a new subject in Pakistan.
I think we need to have paid maternity leaves to this effect too at the end. I think the whole system that needs to be revamped in order to facilitate the mother. Basically.
And everybody needs to sensitize on the importance of breastfeeding and time duration of breastfeeding. It is very, very important that every child should receive exclusive breastfeeding till 6 months of age, and after that it should be continued till 2 years of age, in addition to appropriate complementary feeding. This is the root cause of malnutrition, overnutrition as well as undernutrition.
Right, Dr. Saiba, but I think, sir, you must also tell us about that, what all is the government doing on this very issue that she's raised.
I would just like to add that the government has this policy for maternity leave, and it is a paid maternity leave, But the problem is that it is not implemented, especially in the private sector. They don't follow the rules of the government, and they usually try to bypass these by making different excuses and don't give these paid maternity leaves. But in the public sector, this maternity leave is given, and it is a right of the woman, and if she is not given, she can go to the services tribunal, she can complain, and many people do that and they get the leaves.
I generally feel that a lot of mothers now, as a matter of choice, they prefer not to breastfeed their children. They feel that, you know, if there's top feed available, why should they spend that time? Why should they make that effort? So I think this is something which at the end goes back to the mother and her own personal choices.
That is because these mothers are not sensitized enough the importance of breastfeeding for not only for the child but for themselves as well.
Right, exactly, because breastfeeding is that very important thing which helps you create that bond with your child at the end of the day.
But still there are two areas, you know, one is the mother sensitization, that is important, but then giving the environment is also important.
Right.
If you go to the airports, for example, so there in the waiting areas they have placed breastfeeding corners. The government has placed breastfeeding corners. It is an isolated space where the woman can sit, she can breastfeed the baby, she can change the diaper, everything.
Mariam, coming towards you and coming towards the conclusion of the show, I think we must also generally talk about this as a public health concern, because as we all understand, community health is something which falls within public health per se. So if we were to wrap up today's conversation, what are the challenges that we as a society face when it comes to community health, and what is your proposals for the way forward?
I think we talked about a lot of challenges. Pakistan has a quadruple burden of disease where you know, communicable diseases are still rampant. Non-communicable is on the rise, like diabetes, cardiovascular diseases. They are still there, and then the emerging issues of mental health is there, and with the high growing population, we have accidents and trauma related morbidities and mortalities. So Pakistan is faced with such challenges. I think when we talk about healthcare delivery system, we've seen that improving governance in managing the available resource is a critical point. And countries like Sri Lanka has done it. They have limited resources, yet they have better health indicators from many of the oil rich countries of Middle East even, because they have focused on human development. And that is the countries we've always seen that the
and they've also invested in the community-based workers, something which we were earlier discussing. Because you know, at the end of the day, you don't need to go to a proper qualified doctor for every problem. There's so many problems that you could, you know, get solved at a lower level, so to speak. So I think that is also in a way removing the burden from the healthcare system. So things are streamlined.
Exactly. If you see that if you educate a mother, you are educating a community. So if any country who has an improved healthcare system, they have focused on social development indicators like health, like education, and they are actually focusing on that. If any educated, if there's an educated person who has an opportunities of livelihood and who is in a safe, secure environment, they are better equipped to look after
all
their
such
health.
issues basically. And I think in this regard, one proposal which I feel must be, which we all missed, which I would like to add, is the fact that we also need to have hospitals in more rural areas of Pakistan, especially those with advanced healthcare facilities, because a lot of times we see that people in slums, in rural areas of Pakistan, in remote villages, they have to basically travel long distances even to get the slightest of their health issues sorted. So I think that is one area that we all need to work on. So coming towards you, how do you feel can we make the provision of healthcare more affordable and more accessible for the common Pakistani person out there?
Some of the things which the government is already doing and we discussed is like the Sehat Insaf card, so it improves the coverage. Then the other things which the government should be doing is increasing the coverage of health workers, like the lady health workers. They are currently 70% covering the population. 30% of our population is uncovered, and the urban slums, they are totally uncovered. So these are the things which the government should do, so the uncovered areas are covered. Then the other thing is strengthening of the primary healthcare system. So in our case, you see, even if my child has diarrhea, I would take the child directly to a tertiary care hospital, and I would want that the professor treats my child. Some of the primary healthcare services, they need to be strengthened, and the people's trust on those primary healthcare services needs to be there, so that they don't walk into a tertiary care hospital even for simple cases.
Right, sir. And I think in this regard, we must also talk about improving the quality of the healthcare, because making it accessible, making it affordable is one thing, but improving its quality per se is an equally important component. So at the end of the day, I know you've had international experience as well of working with different developmental agencies. How do you feel can Pakistan improve its quality of healthcare for the common Pakistani citizen out there?
Yeah, so it is a very relevant question. So if we look at, especially I will talk about Punjab, because in Punjab we have a very good coverage now. So we have been focusing on quantity of our health services for the last many years, and we want that all the people, they at least access our health services. So we are quite well in this area now, but the quality of services is a big problem. Even like when we talk about maternal care and skilled birth attendance, so 80% of our women, they are getting skilled birth attendance at the time of delivery in Punjab, but the maternal mortality, it is not going down, the neonatal mortality, it is not going down, and the reason for that is that the quality of those services, they are not being uplifted at the same pace as the quantity has been done. So quality is a big thing which needs to be done, and the government is gradually moving towards that. The establishment of healthcare commission, and then the role of healthcare commission in improving the quality of services.
And I think it gives the common citizens out there a voice, a place where they can go to and complain to. That in itself also adds a very important, check and balance at the end of the day for the medical professionals to give their best to the profession per se. Madam, coming towards you and coming towards the conclusion of the show, as a public health nutritionist yourself, what do you feel, is that most cost-effective, sustainable solution that we can actually deploy if we want to fight off malnutrition in the Pakistani society? Because of course we need to do it within our limited resources. We are a developing country at the end of the day.
This is very much related to, as our previous discussion, that we need to strengthen primary health care setting, we need to strengthen our community health services, and we need to screen out the early detected cases. Nutrition is all about prevention. We don't have to wait for the chronic patients to come over to facility and give them treatment. Instead, we need to strengthen the preventive services, and this is one of the cost-effective solution. In terms of policy making, we need to be very, very cautious, and we need to be very innovative, because we are facing triple burden of malnutrition in the country, and one uniform approach is not going to treat the problem. We need to come up with innovative and problem solving approach in order to address this. And one of the key thing is to strengthen these community health services, to build capacity of community health workers that could empower communities and especially vulnerable part of the community.
And I think also adding on to this, make people realize their very importance at the end of the day. On which note I would like to conclude today's show. Thank you so much, Ms. Mariam. Thank you so much, Dr. Saab, and thank you so much, Dr. Amara, for being here with us today. Well, to conclude today's show, we generally spoke about community health as it does exist in the Pakistani society. We also discussed in length the various government initiatives, especially when it comes to improving community health. To conclude, the only thing that I would want to reiterate is the fact that when we talk about community health, we must not give it a very myopic or a narrow definition. Rather, we must consider it in a more wide and all-encompassing manner, where when we talk about community health just doesn't include, physical ailments. It must also include mental issues and so many other socially taboo issues which are the one way or the other, affect our health. Because as they say that, until and unless you're healthy from the inside, you can never be healthy from the outside. And it is in this very context that we must interpret the definition of community health thereon. On that note, signing off for today. Until next time, take care and Allah Hafiz.